Hi, my name is McKaylee Miller. So today I'm going to be performing medication administration. Okay, so the first thing I would do is I would make sure that I am in a no interruption zone. With no interruptions, I would make sure that the door is closed and that I would not take any phone calls, as well as limiting any conversations with my colleagues unless for essential information. The next thing I would do is I would get my MAR form and my order form, and I'm going to read both information and make sure that the information transcribed is correct on both forms. So I'm going to look for patient's name, and I see here Jaguar J. Jones, and I see here on the MAR Jaguar J. Jones. Next, I would look for the medication, and I see here heparin, and I see here on the MAR heparin. And then I would also check the dose, and I see here 5,000 units, and I see here on the MAR 5,000 units. I would also check the route, and I see here subcutaneously, and I see here on the MAR subcutaneously. And then I would check the time, and I see here on the order form every 12 hours, and I see here on the MAR every 12 hours. I would also check for any allergies, and I see here on the order form it says the allergies is penicillin, and I see here on the MAR the allergies is penicillin as well. So now that I have verified and identified both forms and make sure that both information is transcribed correctly, I'm going to put my order form to the side, and I'm going to work with my MAR. So next I'm going to perform hand hygiene, and then I'm going to start my first check of the 7 rights of medication administration. So the first thing I would check is the patient's name, and I see here Jaguar J. Jones. Next I would check the medication, and I see here heparin, and I would get all my medications, and I would make sure to check for heparin, and I see here heparin. But I am going to verify it and compare with the MAR, and I see on the MAR it says heparin, and on my file it does say heparin. Okay, so then next it's asking the, I would check the route, and it says subcutaneously, and so I would get a tuberculin syringe needle for a subcutaneous injection. And I would then check the dose, and it says 5,000 units, and in here in my vial I have 10,000 units, which is 1 milliliter. So since I have 1 milliliter and 10,000 units in here, in order to obtain 5,000 units I would do half a milliliter. I would draw half a milliliter in my syringe, and any calculations that I would do or any orders as well for medication, I would verify with another nurse. So I would get my vial, and I would get an alcohol pad, and I would clean the top of the vial, and I would leave that there just to know that I did clean it. And then I would get my tuberculin syringe and needle, and I would make sure that it does say 5,000 units of heparin is subcutaneously with my subcutaneous injection needle and my tuberculin needle. And then I see here I have 10,000 units, which is 1 milliliter, and I would draw half a milliliter in my syringe in order to obtain 5,000 units. I would move this, take off my cap, and I am going to draw half a milliliter, making sure there are no air bubbles in my syringe. So here I have my half a milliliter of my half a milliliter of heparin in my syringe, which is 5,000 units. Yes, and I see I have 10,000 units and 1 milliliter in my vial, and I have obtained half a milliliter, which is 5,000 units, and I'll also verify with another nurse. Then I would recap safely. Okay, and then next I would check the time, and it says every 12 hours, and it is the correct time for this medication to be administered. And then I would check the indication as to why this patient is taking this medication, and for heparin it would be preventing blood clots, and that indicates that it is appropriate for this patient to be taking this medication. And so all elements of legal prescription are included. So that concludes my first check of 7 rights of medication administration. Then I would move on to my second check of the 7 rights of medication administration. So I'm first going to check for patient's name. I see here Jaguar J. Jones. And then I would check the medication. I see here heparin. And I have here in my vial heparin. And then I do have my syringe here with heparin that I just drawed. And then I would check for the dose, and I see 5,000 units. And here in my vial I have 10,000 units, which is 1 milliliter. And then in here in my syringe I have half a milliliter of heparin, which is 5,000 units. And any calculations I would also verify with another nurse. And then it says subcutaneously, and I do here have my tuberculin needle and syringe for a subcutaneous injection. And then I would check the time, and it says every 12 hours, and it is the correct time for this medication to be administered. And then I would check the indication of why the patient is taking this medication, and for heparin it would be to prevent blood clots, and that indicates that this medication is appropriate for this patient to be taking. And then so all elements of legal prescription are included. So that concludes my second check of the 7 rights of medication administration. Next, I'm going to get a piece of tape, and I'm going to write the drug, the dose, and the patient's name. So I have here heparin, and I would also check and make sure my vial does say heparin, and I did draw half a milliliter in heparin. Okay, then I would write the dose. So it says here 5,000 units, and in here I have 10,000 units, which is 1 milliliter. And then in here I do have half a milliliter of heparin, and I would also verify my calculations with another nurse. And then I would write the patient's name, and I see here Jaguar J. Jones. I write Jaguar J. Jones. Okay. And I would get this label, and I would put it on my syringe. And next I am going to take my vial, my syringe and needle, and my MAR into the patient's room. Okay, and I would perform hand hygiene, and I would knock, and I would explain the procedure to the patient. Hi, Jaguar Jones. My name is Michaela Miller. I'm going to be your student nurse today, and today I'm going to be administering your medication. So I would raise the bed to a working height, lower the side rails, and make sure the patient is positioned comfortably. And then I would start my third check of the 7 rights of medication administration. So I would, for verifying patient, I would use the armband, and I would verify using 2 identifiers, and I would use the patient's name and the date of birth. So I see here on the armband it says Jaguar J. Jones, and I'm going to compare this with my MAR and make sure it's correct. So I see Jaguar J. Jones, Jaguar J. Jones. Okay, and then I see here for date of birth it says 08 08 25 25 1963. Okay, and then on the armband it also does have the medical record number, and we can also verify with that using the MAR as well. So I see here 417 417 63 63 52 52. Okay, and then I would also check for any allergy bands, and I see here that my patient does have an allergy band, and the allergy band says penicillin, and I would compare it with my MAR, and I also do see the allergies are penicillin, so it matches correctly. And so I would also ask the patient for any allergies such as allergic reactions, and therefore I would proceed with necessary pre-administration assessments such as blood pressure, pulse, pain assessment, and lab values for specific medications. Okay, so then next I am going to verify the medication, and I see here heparin, and I have here in my vial heparin. Okay, and then I do have in my syringe it states heparin as well. And I state here that it does say Jaguar J. Jones as the name, and it does match correctly with the MAR as well as the patient's armband Jaguar J. Jones. Okay, and I would also check the dose, and it says here 5,000 units, and in my vial I have 10,000 units, which is 1 milliliter. And I have here in my syringe 0.5 milliliter, which is 5,000 units, and any calculations I would also verify with another nurse. And then it says here for the route subcutaneously, and I have my tuberculin syringe here for a subcutaneous injection. And then the time, it says every 12 hours, and it is the correct time for this medication to be administered. And I would also check the indication of why this patient is taking this medication. And for heparin, it is to prevent blood clots, and so this indicates that this medication is appropriate for this medication for this patient. And so all elements of legal prescription are included. So now that concludes my third check of the 7 rights of medication administration. And so now I am going to put my gloves on. I'm going to don my goggles. Okay. So for a subcutaneous injection, for heparin, it is normally injected in the abdomen. For most subcutaneous injections, they can be injected into the abdomen, the dorsolateral aspect of the outermost part of the upper arm, and the vastus lateralis. Okay, so I am going to get an alcohol pad, and I'm going to clean the injection site. and going in circular motions. And for subcutaneous, if I was able to grasp 1 inch of tissue, I would inject at a 45-degree angle, and if I was able to grasp 2 inches of the tissue, I would inject at a 90-degree angle. So I'm going to take my cap off, and I am able to grasp 2 inches of the tissue, and I'm going to inject at a 90-degree angle. And for heparin, I would inject slowly for over 30 seconds. Okay. Then I'm going to gently apply pressure onto the injection site, and I would also have also checked for any bruising or lesions before the injection, as well as for injecting for more than 30 seconds for heparin is to avoid any bruising as well. Okay, and after I did that, I would dispose of everything into my sharps container here, and then I would raise the side rails of the bed and lower the bed down, and then I would position the patient comfortably, and then I would remove my gloves facing towards the trash can. Okay, and I would perform hand hygiene, and after that I would assess the patient for any allergic reactions, as well as I would document the procedure on my MAR, and as well as document and observe if the patient's response is as indicated, such as pain medication. And I would also re-enter the room and reassess the patient's response as indicated.